Knock, knock, knock. I'm performing hand hygiene. If there was another person or patient in the room, I would ask them to step out if they could, or I would close the curtain to provide privacy for this patient. Hello, my name is Taylor Grisham, and I'll be your student nurse today. Can you please tell me your name and your date of birth? How are you today? Like on a scale of 0 to 10, 0 being no pain at all, and 10 being the worst pain you've ever felt in your life. What is your pain scale today? Great. Do you wear any glasses? Do you have a sore throat or anything I should know about? Do you have your tonsils removed? Great. So speaking of, I would like to assess your eyes, ears, nose, throat, and mouth today. So we're going to start with your eyes to begin with. I would have this patient stand 20 feet in front of a Snellen eye chart and cover one of their eyes, and then read with the eye that is uncovered the smallest line that they could, and then I would have them do the exact same thing with the other side, or with the other eye. He has 20/20 vision, which is perfect. I'm now going to feel your eyes and your eyebrows. Eyelids and eyebrows are symmetrical without tenderness or edema. Normal hair distribution of brows and lashes. Okay, Mr. Teddy, will you look up for me, please? I'm going to look at your conjunctiva and your sclera and your puncta. Conjunctiva is pink and moist. I'm now looking at the sclera. The sclera is white and moist. The puncta is pink and moist as well, and the cornea is intact. I see no signs of discharge or redness. Okay, now I'm going to have you focus on this part of my pen, and with your eyes only, keeping your head still. This will be the 6 cardinal positions of gaze. Now, if you'll follow this end of my pen again, and I'm going to go in and get very close to your nose, follow with your eyes only and not your head. Okay, now I'm going to put my hand up and touch your nose and check to make sure your pupils are constricting correctly. And the other eye. I see no signs of nystagmus, strabismus, or ptosis. Now I'm able to say perla, that the pupils are equal, round, reactive to light, and a combination. The iris is black, symmetrical light reflection bilaterally noted. I'm now going to move on to your ears. Looking at your external ear, I can tell the auricle and the pinna is aligned to the outer canthus of the eye, and the color is consistent with your face. I'm now going to look in your ear. Looking inside your ears, I see no signs of discharge besides a small amount of sebum or cerebrum or ceramin. The tympanic membrane is intact, translucent, pearly gray, with cone to light, and I'm now going to palpate the outside of your ears. Let me know if you feel any pain. Do you feel any pain? Great. Also, while having a conversation, I can tell that there's no signs of hearing loss or hearing problems. There's no lateralization to either ear with the Weber test 2 and 2-to-1 air conduction to bone conduction with the Rhine test. Now moving on to the nose. I will be feeling your nose for tenderness. Let me know if you feel any tenderness. Do you feel any tenderness? No? Great. I can see that his nose is symmetrical with his face and the color is appropriate or consistent with the face. I will now be examining your septum and your internal structures. I see no signs of deformity or inflammation. Terminates our pink septum is intact. I also see some clear drainage due to ragweed season for allergies. I will now be shining my light on your nose to see the sinuses. They are non-tender with positive illumination. Can you please close one side of your nose with your finger, please, and breathe? Great. Can you do it again on the other side? Do you feel any pain breathing or any problems breathing? Great. Okay, now moving on to the mouth and the throat. I can see that your lips are pink, not cracked, moist. If you won't mind, will you please open your mouth and stick out your tongue? I can see that the tongue is pink and moist. Can you please lift up your tongue, please? The dorsal part of the tongue is pink and shiny. I can also see the veins. I can also see the gums are pink and moist with no inflammation or redness. The teeth are white, and I see no missing teeth or erosion. Looking all the way in the back, I can see the tonsils, and I see they're not swollen or discolored or red or anything. They are +1, and the gag reflex is present. Repeating that the uvula looks intact and is midline. Can you please say "ah" for me? As the patient says "ah," I can see the soft palate and the uvula rise. I would like to repeat that the lips, tongue, and mucous membranes are pink and moist and intact. And that's all I can do today. Is there anything I can do to make you feel more comfortable? Is your pain still at 0? Great, thank you. I'm washing my hands.